Welcome back to this Thursday. The health care bill signed into law by President Obama right there last week may help many Americans over time, but will it help Democrats politically or hurt them come the next election? Joining us right now, two candidates for U.S. Senate from Pennsylvania. Congressman Joe Sestak is a Democrat. He's on the left part of the screen, appropriately enough, and former president of the Club for Growth, Pat Toomey, is on the right. Good morning to both of you.
Morning.
Good morning, Steve.
Congressman Sestak, let's start with you. Was it a hard vote for you to vote for health care? Because a brand new USA Today poll shows that 2/3 of the country says this thing costs too much.
No, not at all. And this isn't about politics. It's about what's good for the working family. And I understand that there's no public policy that's more intimate or personal than health care reform. I know. My daughter had at 4 years old, 4 years ago, had a malignant brain tumor, given 3 to 9 months to live. She's here today because of the military's health care plan.
That's great.
I got in, not because I'm liberal or because I'm conservative. I got into this for health care because I'm pragmatic. All the military has health care, and the dividends that accrue from healthy warriors and families covered is immense. I'm sitting in Philadelphia. 66% of the uninsured today here are working. We lose $150 billion a year because of the more sick they are. So that's why I got in it. It's good for the working family.
All right. And now, Pat, Joe's going to be out in Pennsylvania, and he's going to be listening to his constituents over the next week or two. And he'll get a good idea of the reaction to his vote on health care. Why do you think it was wrong that he voted for it?
Well, I think he's going to get quite an earful because I'm crisscrossing Pennsylvania all the time, and this is a bill that people don't want. I'll tell you why. First of all, over 2,000 pages of new mandates that are going to drive up the cost of health care when we ought to be driving it down. $500 billion of new tax increases, including taxes on employers and employees, taxes on jobs. At a time when we don't have enough jobs, we need to be creating more. And over $1 trillion of new spending, much of which is money we don't have. It's going to increase our deficits, create new debt at a time we can't afford it. We do need health care reform. What we don't need is a 2,000-page massive bill that disrupts the whole system.
Hey, Joe, going into the primary, and you're squaring off against Arlen Specter, you've got all these attorneys generals across the country, and they're suing the federal government, saying this is unconstitutional. This can't stand. So it's not as if you voted for it and suddenly it's going to go away. This is going to continue with you right up to the big vote for you.
Absolutely. Look, I know it's April Fool's Day. How silly those comments are by both Pat and, well, his attorney generals. Look, we're actually going to reduce premiums 15 to 20% over the next 6 years.
We hope.
Since over the last 8 years, the premium's gone up 100%. Small businesses here in Pennsylvania pay 18% more than large corporations because if they have one person with cancer and they're trying to negotiate with Blue Cross Blue Shield as a small company, they can't spread the risk. So we're going to reduce that 18%.
Joe,
going across Pennsylvania,
right
what I hear is we need this.
Okay, Pat, I'm going to give you 20 seconds.
Well, I mean, first of all, you can't impose all kinds of new mandates and think that that's going to lower the cost. You can pound your chest and be very proud about all the things you're going to force coverage. That's going to drive up the cost, and the CBO has said so. It said that the cost of obtaining health insurance will be higher under this bill than if we had never passed the bill. And that's just the cost of the insurance itself.
I got a feeling you two are not going to be agreeing on this. Continue on with your campaign. Our best to Joe Sestak and Pat Toomey. Thanks for having us. All right.
Thanks, guys. Good.